Thank you, Dana. I have the great honor of presenting, along with many of my other dear friends and colleagues, the work that we've done in the Task Force on Sudden Cardiac Death in the Young. Let me say up front that none of the speakers have any disclosures of relevance, and actually I would love if the speakers could come up to the stage. I will introduce each of them as they come to their part, but if we could get everybody up here, that would be wonderful. Hopefully everybody's here. Nobody's running up to the stage. Oh, here we go. Great. I want to, as our speakers are coming up here, thank all the members of the task force, and you'll see their names as we go forward. I want to thank the co-chairs in particular and the people coming up to the podium. Great things have been achieved, and I hope you will see those here today. And I would like to say that we're not even close to being done. When we started this many, many years ago, we had many goals in mind, and they've evolved, but our goals have been as follows. Obviously, we want to prevent sudden cardiac death in our youth by advocacy and implementation, and that includes CPR and AED education for all students. It includes putting CPR AED programs in schools, advocating for cardiac emergency response plans for all schools, and probably most importantly, providing the tools and the resources, including the education for the schools and in the community so we can get to these goals. Now, is there data to support these needs? I don't think I have to convince this audience, but I think it's always good to review the data and to know that there is data out there not really opposing what we think is going on and what we think we need to do. And in order to maybe prove this to you, I thought it would be worth, as an introduction, reviewing a couple of very important studies. This was a study done about 2 years ago, published in JHHA. It deals with survival after out of cardiac arrest in children. It's prospective, which is good. It's from the CARES registry. It takes a look at kids less than 18 years of age over this 9-year period of time, and it assessed the survival to hospital discharge by age, gender, race, and it looked at several different age groups. I won't read them to you. You can see that there. But it takes into account of almost 2,000 children of all different ages. The other very interesting part of the study is it assessed whether there was an improvement over time. Are we getting better? Starting in 2005, going all the way up to 2011, albeit a few years ago, but 3 different important periods of time. And very soberingly and very sadly in that study, the overall incidence of survival to hospital discharge in kids was only 8%, 8.2%. And even more sadly, in infants and younger children, the data was less. They were less likely to survive. And even more sadly, not that I'm trying to make you sad, but there was no change over time. There was no temporal improvement over time. Survival rates over these 3 periods of time did not change. Study number 2. This was again from the CARES registry. It was in North Carolina, published again 2 years ago. This was in JAMA, examining the changes over time in resuscitation performed by bystanders and first responders following statewide initiatives in North Carolina to improve resuscitation efforts. What were those initiatives? Well, those initiatives were to train members of the general population in CPR and in the use of AEDs, train first responders in team-based CPR, including high-performance CPR, and something we've heard about a lot over the last few days in training dispatch centers to recognize and talk people through cardiac arrest. And they specifically examined the association of bystander and first responder resuscitation efforts, almost 5,000 patients with out-of-hospital cardiac arrest, and this is adults, not kids, over a period of 3 years. And what they found in this study is that bystander CPR, first responder defibrillation in combination increased survival from 14 to 23%, still not great, but better. And survival with favorable neurologic outcome increased from 7 to about 10%. Again, you know the numbers, they are what they are, but there was a slight improvement here. And after adjusting for all the things that they needed to adjust, bystander first responder interventions clearly were associated with higher survival rates to hospital discharge. So what might be one of the problems? Again, I know I'm preaching to the choir. I think you know the answer to this. But I love this study because it is an incredible study that teaches us a lot of what we already know, but makes it real, so to speak. And this is a study done by our friend and colleague, John Dresner. This was done in 2013, and it's outcomes from sudden cardiac arrest in U.S. high schools. Again, it's a 2-year prospective study, as you all well know. Prospective studies are much better than retrospective. It looked at over 2,000 schools, and over 2,000 schools that actually had CPR AED programs. And it was over a period of 2 years, with the primary outcome being survival to hospital discharge. So this data is incredible. The survival of all cases of cardiac arrest in the schools was 71%. That's the bar all the way over to the left. The survival of student athletes and adults who had witnessed ventricular fibrillation was almost 90%. And you had a 4-fold odds ratio of survival if you had this happen at a school that had a CPR AED program versus EMS. Now, here is the key question. Does anybody know what the frequency of bystander CPR was in this study? Anybody know the answer? Take a guess from the audience. 94%. 94%, incredible. So obviously one of the problems, and we know this, again, it's silly for me to be telling you this because everybody in this audience knows it, and that's why we're here, is the low incidence of bystander CPR. How can we improve this? Can we achieve 94% on Bourbon Street, or on Michigan Avenue in Chicago, or on Fifth Avenue in New York? Can we achieve that? And I think one of the ways to think about that is CPR AED education for everybody. Again, that's why we're here. And so that we can increase the incidence of bystander CPR. And one of the ways to approach this, one of the many ways to approach this, is to legislate, not just suggest, but to legislate mandating that this be done in the schools, CPR AED education for all students. It's certainly a grassroots effort, and it's one of the focuses of our task group, as I mentioned to you. This is where we were 4 years ago, 3 to 4 years ago, when we first started pursuing this through the task force. 27 states, about 1.6 million kids per year. I don't want to steal Jeff Ranous' thunder, because I want him to show, and he will show, where we've come. But this is where we started about 4 years ago. More on this in a little bit. The state mandates are unfunded, and this is a major challenge. We know this. However, rather than looking at it as a barrier and as a challenge, I think we should approach it as a true opportunity. It allows for partnerships to implement. It allows for ongoing advocacy. Projects such as you'll hear about for low-cost CPR AED education allows for sustainability, all of which I think will be very helpful in going forward. So how do we get to the state legislature? Partners are critical. There's no better spokesman than every single one of you in the audience, including parent organizations. We'll hear about that. Other advocacy groups that we know about, AHA, American Red Cross, and individual physician leaders, spokespeople, and survivors, and people who've unfortunately not been able to experience survivor. I want to take you through a video, and if you haven't seen it, you need to see this. It's about 3 minutes long, so I apologize for the length. But this takes place in the Wisconsin legislature in January of 2016. It's at a hearing with regard to the potential state law to mandate CPR AED education in Wisconsin. You'll hear Joe Lemmel testify. Joe Lemmel was Adam Lemmel's father. Adam is after whom Project Adam is named. And Adam died in January of 1999 in a suburb of Milwaukee while playing in a high school basketball game. So again, I apologize for the length. We're still going to have time, but I really, really want you to hear this. It's bone-chilling, but it really tells you why we're here and what we need to do and what people have experienced. Volume.
This one, we're going to kill two birds with one stone, so. That's what I meant. See you later, Malin. Hi, guys. Thanks very much for coming today. It means a lot. Appreciate it, and appreciate the great work you do over there at the Medical College and Frederick and Children's Hospital of Wisconsin. So, welcome.
Thank you. Appreciate being here. My name's Joe Lemmel. My story is going to be a little different than the ones you've heard, in that I had the experience of watching my son collapse and die We were at a high school game. I'm sorry, break it down. We were at a high school basketball game, which I've gone to hundreds of times. He was a star athlete. He won state in tennis as a freshman, as a sophomore. Was on the basketball team. At some point, we said, you got to start picking some of these sports. You can't be on every sport. So he was tireless. He was absolutely tireless. And as we were sitting at the game on a Friday night, it was an away game. At one point, he walked off the court, and he was probably from me to you in terms of distance, and he just collapsed. And I ran down. Somebody said, well, he's having seizures, and he doesn't have seizures. There's got to be something else going on. And that's a component of what you're going to make possible. People will recognize that there is something going on, and it's not seizures. So that's a critical part. So I yelled into the stand for somebody to call 911, because obviously there was no protocol in place like what we're doing with Project Adam and helping schools put that protocol in place. And I'm going to play the time with you differently, and that you're now me, you're standing over your son. Count the seconds it took to get from the stand to look at him. Disagree with the first onlooker. Finally call into the stands. Person calls 911. And what I've learned since then is you need to be there with that AED and with somebody doing CPR within 2 to 3 minutes. That gives you the survival rate. What you heard as far as how long it actually does take, it's an eternity when you're standing there watching your child die. So my focus and our focus with Project Adam is strictly kids, strictly schools, with an education component that we've always had that mirrors exactly what you guys have an opportunity to pass. I mean, we want every kid, no matter what school they go to within the entire state, get the same protection that my son didn't have. So that's a critical part that we're covering the state. We're not just looking at different regions or different zip codes or different people with the financial opportunity to support. This is community supported. So from there, it's the time for, as you heard, the EMTs aren't waiting outside. But in his case, in theory, you couldn't have been in a closer proximity. They were across the street, 3 buildings down. But it's still, get in my truck, get my equipment, get to the school, get out of the school, walk into the building, walk up to the gym once you finally found it, analyze what's going on, and then finally apply the AED. That's an eternity, because it was well past the point that he had a chance to survive. And I still today live with the image of that flat line and three attempts to try to save him. So when you think of a student body, literally being able to look at him and start that chain right away, every one of those seconds is that precious. So I appreciate what you're about to do.
Thanks very much. This bill is going to pass.
Yep.
In part because of you being here today. I want you to know that.
Thank you for the opportunity.
Doctor?
And the bill passed. And I don't think I can get up there and speak, and any of us can speak more eloquently than hearing Joe's story. And I get chills to this day when I hear that story, when I hear Joe testify. So with that in mind, I would like to have reports to you of what we've been doing in the task force and our 3 committees who've been working very, very hard. And you see here what our tasks are. So it's a great pleasure for me to introduce Dr. English Flack. And English is a pediatric cardiologist at Children's Hospital of Vanderbilt. And English is a Project Adam coordinator at Project Adam in Tennessee. So it's a great pleasure.
Good morning. So for our Committee 1, we focused on school CPR and AED programs. And our focus was really on what resources we could find, partners for the schools to help actually implement the programs. We wanted to define the barriers that a lot of these schools were meeting. Some of them are obvious, but you'll see that we found quite a few. And we have a school case study that I'll present to you as well. I'd like to thank all the members on the task force. This was a pretty large effort, so I thank all of you for being involved. So about everyone in this room has a why. What is your why in terms of what motivates you to be here today. And Adam Lemmel, as Dr. Berger mentioned, Adam has become our why as part of Project Adam. He was 17 years old in Wisconsin. He was an athlete, like his father Joe mentioned in the video, multiple sports, and he collapsed while playing basketball. CPR was initiated on him and 911 was called. It was not immediately recognized, however, that he was having a sudden cardiac arrest. There was no AED available in the school. Despite EMS arriving, Adam passed away. So Project Adam, as named after him, has really supported many, many schools in these efforts of getting AEDs and action plans in place. So when we sat back and thought about barriers that these schools were meeting, the unfunded legislation has been a major one. It is wonderful that we have had legislation throughout the nation in pushing AEDs and CPR in schools, but unfortunately it's often unfunded mandates because the schools have to work within the confines of their financial resources. So there's a definite financial burden that is very obvious. There's also an educational burden. We're asking a lot of teachers in terms of teaching CPR to students, and many teachers feel like they just aren't well equipped. So it's a high task for them, and to motivate them and give them the resources to feel like they have the ability to do it. We are running into barriers of tracking compliance in terms of what schools have resources, need resources, where they are in terms of their AEDs, and are the AEDs up to date in terms of batteries and maintenance and pads. A great barrier is actually finding a champion within each school. And sometimes it's a coach, sometimes it's a parent, sometimes it's a teacher or a health nurse. Oftentimes we find a great champion within a school, but then because of high turnover rate in many of our public school systems, that champion then moves on to something else. So other than that, school administration buy-in, when you present the facts, and especially if you have a personal story or an event that has happened within a school system, that often moves administration forward like nothing else can. But just letting the administration know the importance of this and the sudden cardiac arrest that can happen and the need. Then fear of liability. So the administration saying, yes, I hear your need, but going back to legislation and what their barriers are. So general themes for success, wonderful when you find that school champion. Having organizational support throughout the school where their emergency action plans can be formed. The CPR and AED legislation is a great success, which Jeff will touch on later. And then having administration buy-in and having everyone come together is just a great form of success. So our findings in terms of resources are listed here. Definitely going back to the National CERP recommendations is important. The local fire and EMS have served as resources all throughout, and we're finding sometimes that the local fire and EMS are very willing and able to be involved. It's just making those connections with the school that are not obviously there. The Departments of Public Health is a great resource. The CPR and AED vendors and distributors, they are often very willing, and it's just helping to make those connections. The CPR and AED mission-based organizational support, there are many grassroots efforts such as Project Adam and others that are very willing to be helpful resources for the schools. And then we have a toolkit too that we've created that Dr. Vetter will touch on. So here are some of these resources. So I won't go through all of them. Many of them may be familiar to you. Many of you are here today from all of these resources, and we thank you for that, because we certainly couldn't do it without an enormous team. And just lastly, I have a school CPR and AED case study. So original barriers in this certain school that we were speaking of was administration buy-in and funding, a very, very common barrier to so many of these schools. The champions in this school in Wisconsin were 3 district nurses that really took it upon themselves to move this forward. The district administration was on board, as well as committed staff on the response teams, informing the response teams throughout the school. In terms of overcoming barriers, the CPR and AED efforts were rolled in as part of the school budget. The response teams and drills were held within each of the school buildings annually. Now AED units are maintained within the school, and students learn CPR prior to graduation. So this is not an effort that's placed on any one teacher or one coach or one school principal, but involving all of the staff, annual drills, and having the students aware of it as well, and then participating in the CPR education really, really helps this become a successful story. And as many of us know, you may start with one idea and hope for success that looks like a straight line to you, but it's often a very, very circuitous route with many barriers and restarts along the way. So that's what success really looks like.
Thank you, Dr. Flack. The second of 3 committees is going to be represented by Dr. Vicki Vetter and Martha Lopez-Anderson. Dr. Vetter is a pediatric cardiologist and pediatric electrophysiologist at Children's Hospital of Philadelphia and the University of Pennsylvania. Ms. Martha Lopez-Anderson is the director of Parent Heart Watch and the director of Project Adam Florida. So I would ask them both to come up and we will hear from Committee 2.
Thanks, Stu, and good morning. Certainly been an honor to work with this task force, and I thank Stu for his leadership and Sandra and her staff for making this go forward. The Committee 2 objectives were to create a web-based resource with teaching tools to increase awareness of sudden cardiac arrest in youth and improve CPR and AED training to advance the placement and use of both of these in schools, communities, and the workplace. We have developed a toolkit that provides access to CPR and AED programs, to resources, and it also includes videos about sudden cardiac arrest in youth. We also will illustrate the importance of being prepared in the event of an emergency with case studies. This is the landing page of the website. You'll see the URL at the bottom, and as you look across on the Citizen CPR Foundation website, as you look across, you'll see a tab called Life-Saving Strategies. And under that tab, there are several drop-downs that include information about learning CPR, doing CPR, resources for that, and one of those tabs, I think the third one down, is CPR in schools. And if you click on that, you'll come to this landing page that as you scroll down this page, you will find information about how to start a program of CPR and AED implementation in schools, various resources for how one can accomplish this. And further down the page, there will be this page with 3 different bins. One has the resources. There are many. One is the American Heart Association's Be the Beat, which has various lesson plans that are age appropriate for different age children. The Sudden Cardiac Arrest Foundation, you can save a life in school and on campus, and a lot of resources as to how to do that. What's listed here as National Task Force is actually American Heart Association page that has information that Jeff will tell us more about, but that provides the templates for cardiac emergency response plans. And then Anyone Can Save a Life is another resource. There are a number of program examples. Kids for Kids has information about a program where actually children can teach other children how to do CPR. Project Adam, you've already heard about, is a national resource with affiliates in 14 states, soon to include many more. There's information on this website about how to start a school plan, a school manual, so that you can go into schools and help the staff there learn what they need to be doing. The ACT Foundation is in Canada, and they do amazing work training others in doing CPR and using AEDs. And Illinois Heart Rescue, we've heard a lot at this meeting about the wonderful work that they do, and there are many resources on their site. Why It Matters includes a number of videos and information, as English indicated, telling the why, which is incredibly important to motivate us and to motivate those that we speak to about why they should take action. But there are many other programs, and this website is an evolving site. So as new programs come on board, or if you find that your site is not included, please let us know, because we want to be totally inclusive and have links to all programs that are available. But I just put this slide up to indicate that there are programs in various communities and states that may not have a national website, but show that there are creative ways to teach CPR and AED use. So we had a program in Philadelphia where we went into 15 of the public high schools and challenged them to develop programs to teach their peers CPR and AED education, and then invited them to Franklin Field, which is our local stadium on the Penn campus, to participate in a competition motivated by some prizes, but I think more than anything by school pride. They marched into the stadium carrying their school banners, met by the Philly fanatic who also learned how to do CPR, and they presented their various programs, and they were incredibly innovative. They had websites, they developed songs, rap, songs, and all sorts of other interesting ways of teaching their peers CPR, and they practiced for this competition. And then they were involved that day in a number of activities, a compression challenge, a 2-minute turnaround where they had to run up the football field, come back and do CPR, mock codes where they did incredibly well as teams. And a year later, we went back into those schools and tested their skill level. They had retained 89% of what they had learned. So it was a rather remarkable way to involve the students in CPR, and now they're part of the generation that will become, we hope, bystanders. So I'd like to turn this over to my colleague, Martha, to tell you a little bit more about what our committee has done.
Thank you, Vicki. So understanding the barriers is really critical. Some of the barriers are real, some are perceived. The lack of awareness and understanding of what sudden cardiac arrest is and how it can be prevented. People still have fear that they're going to hurt someone by performing CPR. And then the fear of being sued is something that we still hear about. We still have to work on that. And oftentimes, particularly as it relates to schools, we hear much about time and the need for help, for guidance, and of course, much needed resources, financial resources. And overcoming those barriers, there are many ways to do this. We clearly have to work on giving people confidence to act, and this is why the programs that have been talked about, that English and Dr. Vetter talked about, are so critical, because this is another way, again, of empowering people to take action. So the resources to obtain AEDs, this is something that we constantly hear about. Our schools or our community facilities need AEDs, but we just don't have the resources. So I want to share with you many different ways that we can go about it. In our schools, we have our PTAs and student or booster clubs, and we just have to, again, educate those at the school level so that they understand the importance of being equipped with these devices and to make it happen. In our communities, we have civic groups such as Rotary, Kiwanis, Lions, Junior Service Leagues, and these groups all, again, if we go before them and we educate them and inform them, they're more than willing to help when you're talking about buying a life-saving device. And then you have the Parent Heart Watch and member programs. The Get Charged Up program is about not only providing the schools with the devices, but ensuring that they have a written and well-practiced cardiac emergency response plan. And member foundations across the country in 38 states now that facilitate the placement of AEDs in schools, and also CPR and AED training. Businesses is another way. We all have businesses in our communities, and we just have to reach out, explain to them the need for these devices. Many restaurants have programs, give back programs, and you just have to, again, look into those and ask for them to support you. Many different ones, from TGI Fridays to Chick-fil-A to Jersey Mike Subs. I mean, there's many different restaurants that will give back to the community. And professional sports. Professional sports have incredible resources, and again, engaging sometimes professional athletes in helping us to get our schools safe. Crowdfunding, this is something that we're hearing more and more about, and these are ways of getting, schools can initiate their own campaign for their school, and that's through Got AED and Think AED. They can raise the funds to get their school equipped with the AED. Grant programs are available through the AED Superstore, aedgrant.com. AED manufacturers a lot of times have different contests for you to win an AED. And your community foundations are yet another way to secure these devices. So we have to get creative, and there's many ways, and we just have to seek the opportunities before us. So I'm going to share with you two brief case studies, and this one is from the state I'm from, Florida. Abel was at a Florida high school, and in Florida, all high schools that are members of the Florida High School Athletic Association are required by state law to be equipped with an automated external defibrillator. And when Abel collapsed, he received CPR from the school nurse and the coach, and the AED was in a golf cart on the same field that Abel collapsed, and the AED was never retrieved or used. And today, Abel lives in a permanent vegetative state. And so, why did this happen? They were required by state law to be equipped with the device, but they weren't prepared. They did not have a cardiac emergency response plan to properly and quickly execute the cardiac chain of survival. And so this is the outcome. Look at the cost of taking care of Abel, estimated at over $15 million, all because a school was not prepared. And we can do better. And this is why it's so critical that we make sure that we're all prepared for these cases. This happened not on a school property. This was at home. And so when 17-year-old Nick was lying unconscious on the couch at home, his brother noticed and realized that he needed to take immediate action. His brother immediately moved Nick to the floor and used the skills that he had learned earlier in life. His brother, 19 years old, but had learned how to do CPR in middle school. And he sprang into action, started doing CPR while the father called 911. And then the parents stood there and watched while one of their child was dying and the other one was desperately trying to save his brother's life. And this is a good outcome. So Nick is alive because his brother was prepared and knew what to do. And someone called 911 and the EMS arrived and used an AED on Nick. So again, another example, outside of the school, but critically important for all of us to be prepared. And so one thing that I didn't tell you when I first started speaking is that I lost my 10-year-old son to sudden cardiac arrest. My son never missed a day of school, never missed a well checkup, and was rollerblading when he collapsed. And those that witnessed his collapse at first thought that he was just having a seizure. And so they thought that the right thing to do was to wait for his seizure to be over. 911, calling 911 was delayed, starting CPR was delayed, and the availability of an AED, obviously, it was in a community on a sidewalk, and it took paramedics more than 10 minutes to arrive. Sean's heart was shocked more than 5 times, but unfortunately his heart just quivered. And I can tell you as a parent, I thought that I was an informed and resourceful person, and I was completely blindsided by sudden cardiac arrest. And so it's so critically important that we all work together to do better, because one of the main things that I've learned since losing Sean in 2004 is that many of these deaths are preventable. And so I'm going to share with you what I think would motivate anyone to do better.
His eyes.
Her laughter.
Her smile. I miss her friendship.
Everything.
I miss how much he enjoyed life.
Sudden cardiac arrest in youth is not rare. It's the #1 killer of student athletes during sports. It contributes to the #2 medical cause of death under 25. And it's the leading cause of death on school campuses. People think it just happens, and there's nothing you can do about it. But the truth is, sudden cardiac death in youth can be prevented. We just have to be prepared. So the question is, if we can prevent our kids from dying, why aren't we?
Yeah, why aren't we?
Why aren't we?
Why aren't we? Why aren't we?
For more information about what you can do to protect young hearts, take the prevention promise at parentheartwatch.org.
Thank you.
How can I possibly follow Martha at the microphone? Thank you, Vicki and Martha. Representing Committee 3 is Mr. Jeff Ranous. Jeff is a Vice President of Advocacy and many other roles with the American Heart Association, a co-chair of Committee 3, and we're very excited to hear Jeff's report.
Thank you, Stuart, and good morning. And thank you for setting up my part of the presentation. I know we're running a little bit short on time, so I will be brief, but I am fortunate to be able to end our session on a very positive note to share the progress that we've made over the past couple of years around assuring that everyone is in a position to save a life by requiring all students to be trained in CPR before graduating from high school. As you'll see here, we 2 years ago were identified with the mission in our task force to really take the momentum that was beginning to build across the country in seeing legislation passed to require CPR training in high schools, to take that momentum to really leverage what had been beginning to build and push us to the point where we ultimately, by, I think at that time I charged ourselves, by 2020, getting all 50 states to have a requirement in place. So you'll see here that our charge was to really take that momentum that began in 2012, and as Stu said, by 2015, when we were all last together, we had seen 26 or 27 states with about 1.6 million students annually being trained in place at that time. Happy to say that we have taken that 26 states and we are now up to 37 states, which you'll see here. The good news is that we went from about 50% of the student population to now close to 80% of the student population being covered by CPR and school graduation requirements. So we just in 2016 saw about 1.6 million students. You'll see here when you take into consideration not only those 37 states, but also the work that has happened at the local level in Florida, the work that has happened in states like Montana and California, where they have moved the needle forward. They haven't quite made it an outright mandate for all students in their states, but have taken significant steps forward and are covering big percentages of their students. So when you take the totality of all of the work that has happened over the past couple of years, we are now fortunate enough to report that we are at just over 2.5 million students being trained each year. And that is something that we obviously are going to see in perpetuity. So that is 2.5 million graduating students this year that are trained, 2.5 million next year, and certainly well on our way to create that generation of lifesavers that we all strive toward. Just to give you a little bit of a sense of kind of what's next, we see active campaigns in Kansas and Pennsylvania. In particular in Pennsylvania, any of you that might be from the great state of Pennsylvania would encourage you to take a few minutes, if you haven't already, to talk to your local legislators, because they are really right in the midst of this debate. And we are hopeful that by year's end, with enough calls to action, we can see Pennsylvania get added to that list of states that require CPR training in high school. The last thing that I will leave you with is really building upon what we've heard from the first couple committees and all the great work that they're doing and the critical nature of that work. Because with the public policies that are passing, all it really is doing is setting a foundation. It is setting that requirement that training happens, but we are finding that in the absence of real strong implementation, looking for dollars to fund the training, making sure that we have the partnerships, the leaders in the school, making sure that we have strong cardiac emergency response plan. In the absence of all that, that foundation is simply a foundation. It's not really being built up in the way that we need it to. So while we, again, are excited to report that we are making great progress in our goal to get all 50 states at a place where we want to have that graduation requirement in place, a lot of work needs to continue to really truly take advantage of what we hope is a strong foundation, but again is simply that foundation of which we need to continue this work to carry forward, to make sure that we get the funding, to make sure that we are doing strong implementation, because the public policy in and of itself, again, while is exciting, is really just the first step in this effort. So with that, we'll turn it back to Sue, and thank you very much.
Thanks, Jeff. So let me conclude and summarize, and I promise just a couple more slides. I truly believe that the committees have achieved some incredible successes, and again, I can't thank everybody enough for their great work. Obviously, the people who do this in their spare time. It's not their day jobs, and their commitment, passion, and compassion is incredible. I do think we have some great opportunities as we go forward. We had a town hall meeting on Wednesday night. We had originally slated it for an hour and a half. With some trepidation, we agreed to expand it to 2 hours. I was a little worried that we were going to sit around and just look at each other, and I should know better. 2 hours wasn't enough. We actually went for 2.5 hours, and I think we could have gone all night, honestly, just with the passion and compassion and things that we need to do. So thank you for spending Wednesday night together, or spending it with me at least. And I think we really must continue to move the needle forward, and will not stop until we accomplish all our goals. We still have work to do in the realm of CPR AED education for all students. We're not there. We've made progress. CPR AED program implementation for all schools. We spent a lot of time, very interestingly, talking about disparities, and I know this was a theme at this particular meeting, and we really feel that we want to take this on within the communities that really need help with that. We spent a fair amount of time talking about public awareness of sudden cardiac arrest, and Mary Newman presented some very beautiful data to us, recognizing that we need to get the message straight. We need to get the definition right, all be on the same page, and not work in silos, and we're going to work toward making that happen as we go forward. So there's no question in my mind that the efforts of these people on the stage and the people who have been participants in the town hall, in the task force, I should say, have saved lives and will continue to do that. So anyone who's interested, please join us. There's plenty of work to go around, and we're going to regroup and go forward and continue to achieve our goals and deal with new ones. So again, thank you all very much. This has been an honor. This is an incredible meeting. And of course, happy holidays to everybody. Thank you.